Hi, I'm Chuck Ballard, interventional cardiologist with Piedmont Heart and the Marcus Heart Valve Center in Atlanta as part of the Heart team. So mitral regurgitation is leakage, that's what regurgitation is, and so there are two forms the valve can take. It can either be blocked and not open well, or it leaks and doesn't close well. And so the mitral valve has most of its problems that we see currently with leakage or regurgitation, and it leaks too much. When it back leaks, it overloads the heart. The overloaded heart gets weaker and weaker, and it's a progressive problem. So mitral regurgitation is a disease that's very common. There's over 4 million patients in the United States who suffer from it, and we only treat a handful of those with surgery currently. The MitraClip procedure uses a non-surgical approach to that complex problem. And so we can repair a leakage of the valve where the valve itself is backwashing. And in doing so, it leaks, it causes heart failure, as I described, and we can clip it. So we convert one opening in the valve to two with a very cleverly engineered clip that cinches it together and pulls the valve tighter and then reduces or minimizes the leakage. So MitraClip is indicated for patients with symptomatic and severe mitral regurgitation. And in those patients in whom they have those qualifications where the valve itself is abnormal, degenerated, and are not surgical candidates as deemed by the Heart team. And we have a Heart team of surgeons and interventional cardiologists. We see the patients together. And if the patient is too frail, too elderly and ill with their frailty, not age as a specific piece, and otherwise not a surgical candidate, then we'll offer them a non-surgical approach. The patient will come in the morning of the procedure. They will go to our catheterization lab where we have our team set up. We approach from the patient's leg, either one or both leg veins, and go in with our catheter, a long tube, up to the heart and clip the valve. So the patient can expect it to be relatively painless, under good anesthesia, so they're asleep through the procedure. They awaken with the heart repaired in a relatively short period of time, just an hour to two. Their recovery is also very fast. We can get patients currently out of the hospital usually within 24 hours, at the most 48 hours, compared to a surgical approach which would be approximately a week in the hospital. Likewise, their recovery is just from this puncture in the leg with no incision or stitches or need for other work to be done, and so they can quickly recover and get back to their usual activities. Many of these patients are very limited physically, and this will improve their mobility and lessen their limitations. So it's a great quality of life piece. That's really the big advantage of this procedure. It's been proven many times. Quality of life almost uniformly improves if we can reduce the mitral regurgitation at least in half. Coming to Piedmont for MitraClip gives you a place of a great collaborative team. We have surgeons, interventional cardiologists, the remainder of our team, echocardiographers with great imaging. This procedure is very dependent on teamwork, more than anything else I think I do or we do. That teamwork comes to bear. We have experience. We were fortunate enough to be working with this procedure for now going on 7 years, and it's only been approved for a few years, so we had some early experience and helped actually develop some of the techniques. In developing those techniques, we've then been able to translate that into not only taking great care of our patients, but enjoyably for us and helping more patients as we spread it. We are able to teach other physicians, surgeons, interventional cardiologists, echocardiographers, again, team teaching a team, that approach here as one of a half dozen places in the country. Our volume likewise is at the top of the list, certainly in the top 10 in the country for pure overall volume in the United States. So it's quite the experience and with good outcomes. So then we look next at, well, is it an enjoyable experience and a safe experience? Yes, we think so. We focus on Navigator to help the patients and families. We help you get around this big institution and yet try and treat you as though you're our family and keep it as patient-centric as we can. With that, we work to have great outcomes. For instance, our length of stay is now below the national average a great deal, to just 24, maybe 48 hours at the most, versus what was for us with this procedure and is still with surgical procedures about a week. So much improved. And then finally, when we give that experience to patients, we want them to get the sense that they've been cared for by someone that cares for them with a great deal of skill, and yet that confident humility of doing the right thing for the patient, being humble enough to know that we're all just people trying to take good care of one another, and we want that experience to be as family and patient focused as we can make it.